The word magic bullet was coined for a molecule that had far-reaching benefits to the body, but left the body unharmed. And so this salt, this brilliant blue salt, was used as a dye, right? And they would dye clothing, right? But they would also dye tissues. And they noticed that when they put it into tissues, that it would have an affinity for the mitochondria. So then certain cellular structures would be more dark versus more light. So they could really see the cellular structures very clearly, especially neurological, because that's where you have a higher concentration of mitochondria. So this guy, Paul Ehrlich, was going to do some experiments with malaria, because malaria was the biggest problem back in the late 1800s, because all of our military was getting sick and we couldn't penetrate these forests and these jungles. We're trying to take over the world. And, not that I think it was terrible what we did. I mean, England, United States, we just kind of wanted to go and expand our territories, and malaria was getting in the way. So finding a cure for malaria was the biggest problem at the time. So Paul Ehrlich sat down in front of his microscope, and he got the parasite that's responsible for carrying malaria and put it on the screen. And then he added the dye. And then he has all these different remedies that he's going to check, because now he can see very clearly the parasite with the methylene blue. And then he was going to add an experiment to see which one killed it, right? As soon as he added the dye, the parasite died. So all of a sudden he has his remedy. It's methylene blue. And they're like, oh my gosh, this is antimicrobial. So it somehow starves some of these microbes of oxygen, but it leaves our cells completely healthy. In fact, it charges our cells up. We have a metal roof and it's raining. We got a storm coming through. So I don't know if that's affecting the audio.
I'm not hearing it. No.
You're good? Okay. It's a little bit loud on my side. It's kind of nice, actually. Very soothing.
I'm good then.
That nice rain. So then they found that methylene blue worked to enhance energy at a cellular level. And so it's an antimicrobial. I mean, like I said, we used it for COVID. It's incredible for viruses, bacteria, mycotoxins, and mold. I mean, it's very broad spectrum, and it leaves the body unharmed. That's why they call it the magic bullet. And it if that's not enough, methylene blue works on the SSRI system, and it's actually an antidote for depression. And so they did large clinical trials on depression and found that it enhanced depression better than really virtually anything that they tested. And it really should be the primary treatment for a lot of our mental emotional afflictions that are treated with SSRIs, because SSRIs actually mess up the locus coeruleus. And some of the neuroscientists that I've listened to are quite concerned with the new research that they're finding, because the SSRI doesn't allow the locus coeruleus to work properly, which then you have more stress responses, more norepinephrine, less sleep, less ability to manage circadian rhythm. And then one thing that's really important is something called memory consolidation, where we take our short-term memories from our experiences during the day and we transfer it to our long-term memory banks, where we make sense of what happened that day as it relates to what we've experienced in the past, and we integrate it, right? And this happens when we go into REM sleep every night. But serotonin inhibits this memory consolidation. And methylene blue really enhances it. In fact, they did phobia studies, and they found that even one dose of methylene blue after doing some of these therapies with patients enhanced the results dramatically, because people were able to consolidate these memories. And so there's just so many reasons for people to consider taking a daily dose of methylene blue. It's just so safe.
You mentioned the SSRI piece. There is some data out there when it comes to safety if somebody is on an SSRI or MAO inhibitor taking methylene blue. How do you feel about that?
It's blown out of proportion a bit. It's based on a few incidences where they were doing a thymectomy. And so they would do an IV of a very high dose of methylene blue. And then because these patients had cancer of the thymus gland, so they needed to dissect every bit of it. They don't want to miss any, right? They want to take the whole thing out so they can see it very clearly when they open it up. And they noticed that there was, I think there was 5 cases that were on SSRIs, and 2 of them actually died because of serotonin storm. But these doses were very, very high, and they were infused very quickly. And the Mayo Clinic retracted that warning of SSRIs with methylene blue, and even like the country of Canada. I think you're in Canada, aren't you?
I am, yeah.
Yeah. So you guys don't have that warning with your version of the FDA. But there is a concern when you start getting into some high doses of methylene blue. If you're in the lower dosing, so when you start getting over like 4 milligrams per kilogram of body weight, for most people, it's like 250, 300, 400 milligrams. You can start getting into some of those trouble spots, but like there's so much benefit from like 20, 30, 40, 100 milligrams a day. And you're still so far within that safety range of having any problems. So this conversation is really something that has scared so many doctors away, especially the patients that need it the most, that are suffering from depression, that really need to be weaned off of. So in our clinic, when we have patients, we actually will get them on a low dose of methylene blue and have them start weaning off. And, just also full disclosure, I practice as a chiropractic neurologist in the state of Florida. I also have a naturopathic degree, which in a lot of states I could have full prescription rights. And but in this state, I practice with a board certified psychiatrist. And so she's a medical doctor. And we also have a cardiologist who's a medical doctor. I've got another doctor that's a Chinese medicine doctor that's got his MD. And so, I'm surrounded by like doctors that have this scope that we can take, but it doesn't happen through me, right? So it's a collective team effort, but they really like to wean people off of the SSRIs. And what methylene blue does is it actually treats the cause of the depression in a way that's really interesting. Would you like to dive into that?
Yeah, let's do it.
So nitric oxide, it's got this reputation of just being like this terribly important molecule, and we have to take more of it because it's like good for our cardiovascular system and all these other aspects of health. But there's actually 3 kinds of nitric oxide, and a lot of people don't really break it down like that. And you need to really understand it, because the one that is often like enhanced with a lot of sports drinks is not the good one, right? And it may be okay for some people to take in short spurts before athletic activity, but when people take it ongoing, it can be really, really negative and really put people at risk for stroke and a lot of other inflammatory issues. But it's inducible nitric oxide. Then you have endothelial nitric oxide, and then you have neuronal nitric oxide. And so one of the great benefits of like red light and photobiomodulation is the endothelial nitric oxide. Hyperbaric oxygen really works very well in oxygen therapies on both the endothelial and the neuronal nitric oxide, right? And so methylene blue mops up the inducible nitric oxide, which is the inflammatory nitric oxide, which is the nitric oxide that causes depression. And what elevates this inducible nitric oxide is infections in the body. So we get back to like the doorways, or we might have someone that has a chronic Epstein-Barr infection, or they're being chronically exposed to mold. There's all these different parts like candida. And so now you have the root cause of the depression, which is the infection triggering the elevated nitric oxide, which then when you take methylene blue, it calms that down. And then you have a relief of the depression by treating the root cause, where SSRIs are really just covering over it and actually making things worse because they're totally destructive to your locus coeruleus, your blue spot.
Really important we went there. And that's where I was actually going to go next, the nitric oxide, because every time methylene blue, one of the negatives, again, side effects with different drugs, but then the nitric oxide is the other pushback that people will have when it comes to methylene blue. So glad we went there.
Yeah, and so then you'll have people say, "Oh man, don't take methylene blue. It's gonna it's gonna lower your nitric oxide," and it's like this complete like uneducated, myopic view. And in essence, you're not even touching the good stuff. Like methylene blue does nothing to harm either the endothelial or the neuronal, which is the one you want. It only targets the one that you want to get rid of, which is the inducible. You're looking for like sexual enhancement, like men be like, "Oh man," because that's what Viagra works on, right? Like you can take methylene blue and there's absolutely no negative effect on getting an erection, right? Or getting sexually excited even as a female.
Okay. Important for a lot of the guys and girls to hear that.
Well, that's what I thought, because when I first started really diving into methylene blue, I didn't know all this. And I got sucked into this whole thing too. Like, oh man, am I screwing up my nitric oxide? Am I doing the right thing? And then I just dove into it. Really, I dove into it with who I consider the most educated individual on hyperbaric oxygen. And his name is Jason Saunders. And he actually we co-wrote an article in my second edition of Methylene Blue. It's called Magic Bullet. It's on Amazon. And then Brian Richards, who is highly involved in photobiomodulation, his company is called Sonaspace. Now we actually have like an even more elaborative article that's like kind of a bonus add-on at the end of the book. And I'm going to be releasing this third edition of Magic Bullet probably within the next month. But the conversation, we just got into it, and it was like we're all just like blown away. Like, oh my gosh, like this makes so much sense. Like this is like actually so positive with regards to nitric oxide.
Well, I think it's smart for people to perk their ears and to question all this stuff, because you talked about the history here of methylene blue and the fact that it was originally a dye for textiles and then a dye for surgery. So it's basically, if not totally, a drug. So we need to make sure we do due diligence when we're starting to introduce something like that, that could have potential negative side effects in the body.
You know, there's a gene issue, G6, and it's very, very rare, but it's a pathway that that people have a hard time metabolizing certain things, and like high dose vitamin C IVs is a contraindication with this genetic disorder, and methylene blue is as well. Although I have heard of some people that use it that have that, but I wouldn't recommend it. I've, microdosing, everybody's kind of into microdosing, psilocybin, and other types of compounds that kind of work on serotonin. And I get a lot of questions with people saying, is that safe? And absolutely, totally safe. And in fact, I think even like small doses of methylene blue, even with like MDMA journeys, which is lots of serotonin, can be very neuroprotective and help people integrate their therapy sessions much better. And so I even think that, again, like this is really edgy. Probably I'm going to get a lot of flack for even saying this, but I've seen it, and I've been involved with some of these things, and I've seen much, much better results with, maybe a dose of 15 to 20 milligrams prior to somebody going on an MDMA journey. But this would be absolutely like, most doctors would just be like completely terrified to hear that this is happening. But honestly, like when you really look at the research, there's not really anything in there that suggests that that would be something that would be of concern in those doses.
Okay, so for the average person, adult, wanting to use methylene blue, Obviously, it's going to depend on, where they're at on their health journey and what they want to accomplish with it. But what would be an average type dose? And the way I understand it, methylene blue can be taken orally. And would you ever recommend taking breaks from it, or is it something you'd want to take every day?
Yeah. So methylene blue absorbs really well in the stomach. You don't really want it in the small or large intestines. The large intestines, there's a few good strains of bacteria that have been affected based on some studies I've seen. Um, and it's interesting. There's actually some good strains that have been positively affected with methylene blue. So it's not like universal, but I would say that probably you don't want to be exposing your large intestine. We manufacture a methylene blue suppository, which has a place with some therapeutic protocols, but that wouldn't be a good way to dose it on a daily basis. And taking capsules, um, sometimes those capsules don't open until the small intestines. You can start to develop some leaky gut because methylene blue can be a little stressful on the mucus lining. So you really want something that's going to like fully absorb in the stomach. And so drops can be great, but then that turns the mouth blue. So we make what's called a bar. It's called Lumitol Blue. And it's literally like a square that is a suspension in palm oil. And so you take and cut it into whatever dose you want, throw it in the back of your throat, and then drink something. And then it fully absorbs like in the stomach. And I think that's probably the safest, best way to dose it. So either a dropper in water, you can maybe take a dropper and drop it in the back of your throat and avoid the blue mouth, or this version with the bars.
Okay, and then dosage, typical
There's
dosage.
another part to your question.
Yeah, how much would somebody want to take an adult just as more of a moderate maintenance dose? And then breaks. Would they want to take breaks periodically?
So it can build up in the mitochondria, right? Even though it has a 12-hour half-life, if you take it every day, then sometimes you get to a point in a week, 2 weeks. I've even talked to people that like 3 days later, they feel like they need to take a break. And it's going to be different for everybody. So you kind of have to experiment with it and see what works for you. For me, I can go 2 or 3 weeks and then I'll take a couple days off and just kind of let myself purge. You will pee blue, and that's normal because that's the way it kind of goes out of the system. And so, like when your pee becomes like clear and it's not blue, that your body's kind of cleared it. And sometimes that remains blue shorter or longer, depending on the individual and how they're kind of moving the methylene blue through their system. So taking breaks is a good idea. Dosage wise, 0.5 milligram to 4 milligrams per kilogram. I really look toward the higher dose works better for depression and mood. You feel really good on higher doses. You don't need those higher doses for some of the cognitive and the neurological benefits and the neuroprotection benefits. If you're sick and you're looking to like eradicate something, you want to be on the higher dosing schedule, and you want to combine light. You want to combine red light in the spectrum of 660 nanometers. And like whenever you're looking at a lot of these devices, they usually will tell you like what wavelength that they're operate at. And so you want to find something that's 660, or go out in the sun. The sun is really a great way to expose yourself. You want to try to expose as much skin as you can, go naked if you can. I usually will have my male patients at about 90 milligrams a day as a maintenance every day, and females somewhere around, 40, 45 milligrams.
And yourself, as somebody who's seasoned in using this, I think the way I understand it, for a longer period of time, do you notice a big difference in your cognition and the way you think on a day when you're purging, or if you're purging for a couple days?
Not so much. I have felt like the benefit of the methylene blue, which like I feel more my constitution. I can go longer without getting tired. I can work out. I can lift more weight. I can do a 2-hour podcast. Uh-oh. We just lost. I hope we don't lose internet.
We're still good now.
Oh boy. Yeah. We just lost power.
Okay, we'll see what
Lightning.
happens.
Oh boy. We don't want rain right now. I'm trying to dry everything out at my house. Darn it. Mother Nature. Anyway,
So yeah, basically if you have a day when you want to perform, in essence, would you time that around a day when you're on methylene blue? Or if you're somebody now that's been using it long term, does it really matter?
oh yeah. Yeah. Like, I tell you where I really love methylene blue, because methylene blue is going to help you from getting sick, right? So if you were sick, it's going to help you, and it's going to help prevent you from getting sick. It's going to enhance your endurance. It's going to enhance your mental capacity. So like when you're traveling, you really need this stuff. Like this is really, really great to take on trips, right? And that's where really you see it shine. Or like you said, days that you need to maybe do a presentation at work, or you have some more demand, your workout days, it would be good days. And sometimes you might want to take a little bit more on those days. You might find that a higher dose really serves you a little bit better, but you just really have to play around with those ranges, and don't be afraid to go, if you start like searching on the internet, like, if you pull up methylene blue, like like I think it's WebMD or drugs.com or something, like the first thing they say, it makes you like, can be deadly with SSRIs. And it's like, why would you want to put that out first? It's like, that's the first line, like it's some sort of a dangerous substance. It's, oh, I love our pharmaceutical companies that are in charge of like the media and like what we're reading. They steer us away from all the natural stuff that works, because they want people to be more, their eyes focused on the pharmaceuticals, unfortunately. So, you'll start to see some things that really will scare you away from methylene blue, but they're not founded in the research. And you kind of start to get the same thing with melatonin.
Well, we'll move into melatonin. I want to pause you before we get there because I still want to come back to your morning routine.
Yeah,
But before we do, on the methylene blue, how long have you been taking it for?
probably 3 years.
Okay. So long term, but in the big scheme of life, relatively new.
Right. Yeah.
If you enjoyed that clip, you're going to want to head over here and catch the full episode. I'll see you over there.
I don't think that there's one better anti-aging, life-enhancing substance or biohacking thing that you could do than supplementing with melatonin. Sleep is just a little piece of melatonin. Melatonin is made